Hello friends, let's see the extracranial part of the facial nerve. And along with that, we will also discuss the facial nerve palsy. So as we discussed in the parotid lecture, the facial nerve is going to arise from the stylomastoid foramen, which is situated between the mastoid process and the styloid process. It enters into the parotid gland via posteromedial surface. It runs horizontally and further divide into two divisions, one temporofacial and one cervicofacial division. The upper division, that is temporofacial division, further divide into the temporal branch and the zygomatic branch, while the cervicofacial division is going to divide into the buccal branch, which is going to provide the upper buccal and one lower buccal branch. Along with that, it also gives one marginal mandibular nerve and one cervical branch. Before entering into the parotid gland, the facial nerve also gives few other branches, and these are the posterior auricular nerve, one branch which is going to supply the posterior belly of the digastric, and one more branch which is going to supply the stylohyoid muscle. So we can appreciate that the facial nerve, which is going to run through the parotid gland and going to divide into major five branches, and these are the temporal branch, zygomatic branch, buccal branches, marginal mandibular branch, and the cervical branch. So this parotid gland is going to divide into superficial part and the deep part by this facial nerve mainly, and just deep to the facial nerve we find the retromandibular vein. So the plane is going to form within the parotid gland, that is called as a faciovenous plane, that is formed by the horizontal course of the facial nerve and the retromandibular vein, which is situated just deep to it. We have already mentioned this thing in the uh, previous lectures of the parotid region. So because of this horizontal course of the facial nerve within the parotid gland, surgeon has to keep one point in mind at the time of the excision of the parotid gland or any procedure which he or she is going to perform on the parotid gland, that he has to put incision horizontally only. So if the surgeon put incision horizontally, there are less chances to get injury to this facial nerve. If the surgeon put incision vertically, there are more chances to get injury to the facial nerve, and that will lead to the paralysis of the muscles of the face. So this method of putting incision horizontally over the parotid region for any procedure over the parotid region, that is called as the Hilton's method. Now, after passing through the parotid gland, this facial nerve, as we already discussed, it is going to divide into five major branches to supply the facial expression muscles. So what happens if this facial nerve get injured outside the cranium, or it may be compressed inside the cranial cavity, that will lead to the paralysis of the muscles of the facial expression of the same side. So now let's understand the basis of the facial pulses according to their site of injury. So here this is the schematic image for the understanding of the facial nerve palsy. This facial nerve is the seventh cranial nerve. In case of the most of the cranial nerves, the nuclei of those cranial nerves from where exactly the cranial nerve is going to arise, it is actually situated within the brainstem. So here in this figure, we can appreciate this is the area of the brainstem from where this facial nerve nuclei are present. Now from this nuclei, the fibers are going to arise and they are going to supply the structures which is in the territory of that particular cranial nerve. But this cranial nerve nuclei, they are controlled by the higher center. The higher centers, they are situated in the cortex of the cerebrum. So within this cortical area, the fibers, they are going to arise and reach up to the cranial nerve nuclei. That fiber, it is called as the corticonuclear fibers. These corticonuclear fibers, they are going to supply the opposite sided cranial nerve nuclei. So these corticonuclear fibers, they will reach contralaterally to the respective cranial nerve nuclei. So if we talk about this left-sided corticonuclear fiber, it is going to reach up to the right-sided cranial nerve nuclei. While this corticonuclear fiber, which is situated on the right side, it will obviously gives to the left-sided cranial nerve nuclei. So we have to remember one point inside our mind, that this all the corticonuclear fibers, they are going to cross and they are going to reach up to the contralateral nuclei of the respective cranial nerves. Now, when we talk about the facial nerve nuclei, this facial nerve nuclei, which is situated in the caudal part of the pons, and it is not in the form of a single nuclei. There are so many subgroups of the nuclei are present within the facial nerve nuclei. And from this subgroup of the facial nerve nuclei, the fibers, they are going to arise and they will form the facial nerve itself and going to supply the facial expression muscles and the other territory of the facial nerve. So when we talk about the facial expression muscles only, the forehead, this area, it is going to be supplied by bilateral sided facial nerve nuclei, while the lower half of the face, it is only going to be supplied by the unilateral side of the facial nerve. So we are going to understand this whole process in a simple figure somewhere here. Suppose here this one is the left sided cortical area, and here this one is the right sided cortical area, and somewhere here the facial nerve nuclei is present. So the corticonuclear fiber from this left side going to reach up to the right sided facial nerve nuclei, while the corticonuclear fiber of the right side is going to reach up to the left sided facial nerve nuclei. So they are going to cross with each other and going to reach up to the contralateral nerve nuclei. Now, the from this facial nerve nuclei, the upper part of the face, it is going to represented by the both the sided facial nerve nuclei. Now, from this right sided facial nerve nuclei, the fibers are going to pass and going to supply the whole face on the right side. And from the left side of the facial nerve nuclei, which actually carrying the right sided corticonuclear fibers, they will reach up to the left side of the face and going to supply it. But along with that, this forehead area of the face, or we can say upper half of the face, it is also going to represented by the fibers of the unilateral side also. So this fiber, it is also going to supply this upper part of the face, while on this right side, these fibers, they are also going to supply the right sided corticonuclear fibers. So we can say that this upper part of the face, it is going to be supplied by both the sided facial nerve nuclei, while the lower half of the face, it is only going to be supplied by the same sided unilateral facial nerve nuclei. Now, after having this much information, now we can move on to the facial pulses. Now, along with that, we can understand that these corticonuclear fibers, they are called as the upper motor neuron, while the infranuclear fibers of the facial nerve, which carries the lower motor neuron. So if the injury to the corticonuclear fiber is there somewhere here, that is called as a supranuclear palsy. So in case of the supranuclear palsy, these fibers are going to affect, as well as these fibers, they are also going to affect. So in this case, we can say that the same sided facial expression muscles, they are preserved by the opposite sided corticonuclear fibers, while the contralateral side of the facial expression muscles, they are going to be affected because of the injury to the supranuclear palsy of the left side. But here, in case of the injury to the supranuclear palsy of the left side, the right half of the forehead is get preserved, because this forehead is going to be supplied by same sided corticonuclear fibers also. So the supranuclear palsy of the left side, it affects these fibers which are going to supply left sided forehead, as well as the fibers of the facial nerve which is going to supply this whole right sided facial expression muscles. But along with that, these fibers which are bluish in color, which are going to be supplied by the right sided corticonuclear fibers, they are preserved. So in case of the supranuclear palsy of the left side, the lower half of the right side is only get affected. While we talk about the infranuclear palsy, If this infranuclear palsy is there, that will lead to the paralysis of the facial expression muscle of the same sided face, but the forehead is also affected because with the injury to this infranuclear portion of the facial nerve, that will affect the contralateral corticonuclear fibers as well as the ipsilateral corticonuclear fibers for the forehead also. So in case of the infranuclear palsy, the ipsilateral whole face get affected. So this is the very important clinical understanding. And this infranuclear palsy, it is also called as a Bell's palsy. So the cause of this Bell's palsy, it is mostly because of the compression of the facial nerve when it passes through the stylomastoid foramen or within the facial canal. And this compression of the facial nerve will lead to the paralysis of the same sided facial expression muscles. And now let's move on to the symptoms of this Bell's palsy or the infranuclear palsy. So here in this figure, we can appreciate the left-sided Bell's palsy because the left-sided facial nerve get affected. So many signs we can observe in case of the Bell's palsy. The first and most important sign is the facial asymmetry. And this facial asymmetry, it is because of the unopposed action of the opposite sided muscle. In case of the patient with the Bell's palsy, the loss of the wrinkles, horizontal wrinkles over the forehead is there with on the affected side, and that is because of the paralysis of the frontal belly of the fronto-occipitalis muscle. Patient is unable to close the palpebral fissure, and along with that the tears they flow down from the eyes, and that is because of the paralysis of the orbicularis oculi muscle. The patient is unable to blow the cheek, and the food may accumulate inside the vestibule of the mouth, and that is because of the paralysis of the buccinator muscle. Angle of the mouth is sagging down on the affected side, and that is because of the paralysis of the zygomaticus major muscle. The dribbling of the saliva on the affected side, and that is because of the inability to close the mouth because of the paralysis of this orbicularis oris muscle. Along with that, the patient has loss of this labonasal fold, and this is because of the paralysis of the levator labii superioris alecunasi. So all these are the symptoms of the facial nerve Bell's palsy, and this Bell's palsy is the infranuclear palsy. So in a nutshell, in case of the Bell's palsy or the infranuclear palsy, the same sided whole face facial expression muscles are get affected. While in case of the supranuclear palsy, the symptoms are same, but the forehead area they are preserved, and the paralysis is on the contralateral side of the lower half of the face only. So this is all about the facial nerve palsy. Hope you understand well. Thanks for watching.